This is Crystal Fenn with MedPage Today. I'm speaking with Dr. Furman McDonald of the Mayo Clinic, whose group has just reported some results on a survey of U.S. medical residency programs. So, Dr. McDonald, what did your group find in this study?
Well, our study was addressing the question of the level of pharmaceutical industry support for internal medicine residency training. And it was a study of internal medicine residency program directors by the Association of Program Directors of Internal Medicine, APTIM. What we found was that compared to probably 15 years ago, the number of programs accepting support has gone down. We found that the number of program directors who felt that industry support for residency training was desirable has also gone down. And somewhat surprisingly, we found that while nearly 3/4 of internal medicine residency program directors, 72%, did not feel that accepting support from pharmaceutical industry was desirable, just over half of our internal medicine residency program directors still do accept support. Some corollary findings that were surprising were that programs that programs where pass rates were lower on the American Board of Internal Medicine certifying exam were more likely to actually accept support from the pharmaceutical industry. The reason for that, or why that association exists, we're not sure, but it certainly calls for more research.
So this kind of industry support has been controversial, and different organizations have weighed in on this. Is there a clear sense of whether this is now should be considered inappropriate, or what the future might bring?
That is a question probably beyond the scope of our research itself. We do note in our introduction the position papers that have come out from many organizations, the American Association of Medical Colleges, the Accreditation Council for Graduate Medical Education, the American Medical Association, all have had various positions on papers on this over the years. Few have come to the point of saying that absolutely no support should be accepted. However, our study found that most program directors did not feel that this support was desirable, and unlike the 1990 study, where the majority of program directors felt that there was some educational benefit to this support, or that the benefits outweighed the risks, very few of in our survey, under 16%, felt that there was educational benefit for this. So while I cannot, the answer to your question is really one of opinion, I think our data suggests that there is skepticism in the data that's coming from pharmaceutical industries and the support that is given to programs.
Now, why is medical residency period of such concern with regard to these pharmaceutical relationships?
Well, if I understand your question correctly, the residency is a very formative time for our physicians in training. So we are taking medical school graduates. They've just received their MD, and this is the time where they're learning in the context of patient care. That's really what residency is. We're putting residents, they are the doctors. They're taking care of patients, and they're learning while they're taking care of patients. So it's a very formative time in the development of our young physicians. And so it's important that the data and the information they receive be as accurate and as good as possible. That's what has raised the concern, I think, of many of the organizations you mentioned earlier, and what may be driving the opinions of the program directors we found in our survey.
Well, thank you, Dr. McDonald. It sounds like these pharmaceutical ties to the medical residency programs are still common, and that there needs to be more study into these areas. I'm Crystal Fenn, MedPage Today.